Breaking B.A.D, Barriers Among Disparities, an informational video about the barriers to cervical cancer screening among lesbian and bisexual women in cervical cancer awareness. Before watching the video, please take the Pretest survey. The most important fact: all who have a cervix should engage in routine cervical cancer screening. Cervical cancer can affect anyone who has a cervix. Here are the barriers to seeking healthcare. Fear of discrimination. This could be being misgendered, having assumptions about your sexual orientation, refusal of care, causing harm, and even harassment. Medical mistrust can happen because of past experiences, improper medication, disregard of patient history, or even poor follow-up or aftercare. Limited access to healthcare, health insurance, whether they are underinsured or not insured at all, and being less likely to have a complete understanding of what your health risks may be. So here are the stats. The LGBTQ plus community are at a higher risk for developing cancer. The LGBTQ plus population smoke at a rate that is 50% higher than other adults, and this population also engages in higher risk behaviors compared to others, such as alcohol use, smoking. They have poor eating habits, lack of physical activity, the low use of preventative care, such as routine screenings. Here are the stats for lesbian and bisexual women. Lesbian and bisexual women are less likely to have health insurance when compared to straight women. They are more likely to have been uninsured and have trouble obtaining medical care within the past year. When compared to straight women, lesbian and bisexual women are less likely to engage in routine screenings like a pap smear. Women who have sex with women are still susceptible to contracting the HPV virus from an infected partner, as well as straight women. Lesbian women have encountered heterosexual intercourse, and this increases their risk of contracting HPV. Lesbian women are less likely to visit a reproductive health specialist, and this results in the lack of knowledge about HPV and its effects. So, what is cervical cancer? Like all cancers, this is an overgrowth of cells that takes place within the cervix. The cervix is located at the lower part of the uterus and connects the body of the uterus to the vagina. This is made up of two parts and is covered with two different types of cells. There is the endocervix, which is the opening of the cervix and leads to the uterus, and this is covered in glandular cells. And there is the ectocervix, which is the outer part of the cervix and can be seen by a doctor during a speculum examination. And this is covered in squamous cells. The transformation zone is where the two cells meet. This changes if you give birth and as you get older. Majority of the cervical cancers begin in the transformation zone. What are the causes of cervical cancer? Well, DNA in human papillomaviruses, or HPV. With DNA, there will be mutations, and this can trigger cells to grow and divide or fail to make the cells die at the right time. HPV contains two proteins known as E6 and E7, and they can turn off some of those tumor suppressor genes, which allows the cells lining the cervix to overgrow and develop changes. And HPV can be passed from one person to another during sexual intercourse. It is certain that HPV plays a huge role in the development of cervical cancer. So what are precancerous cells? Precancerous cells are normal cells that gradually develop abnormal changes. These changes can be described as cervical intraepithelial neoplasia, or CIN, squamous intraepithelial lesion, or SIL, and dysplasia. They are graded on a scale from 1 to 3, and this is all based on the amount of abnormal tissue that is present. CIN, mild dysplasia, or low-grade SIL means that not much of the tissue looks abnormal and is known to be the least serious precancer. CIN2, CIN3, moderate to severe dysplasia, or high-grade SIL, is the grade that's given when most of the tissue looks abnormal, and the most serious precancer is high-grade SIL. Here are the types of cervical cancer. The most common type of cervical cancer is the squamous cell carcinoma, and this develops from the cells in the ectocervix and are most often to begin in the transformation zone. Most of the other cervical cancers are the adenocarcinomas, and this evolves from the mucus-producing glands of the endocervix. Cervical cancers that have both characteristics are called mixed carcinomas, and they are less common. What are the risk factors? HPV, your sexual history, STIs, especially chlamydia if left untreated, a weakened immune system, smoking, long-term use of oral birth control pills, economic status due to not having sufficient healthcare services such as cervical cancer screenings, a diet low in fruits and vegetables, those who were born to mothers who took medication to prevent miscarriages during 1938 and 1971 in family history. So the chances of developing cervical cancer increases if your parent or sibling who has a cervix has had cervical cancer. Let's talk prevention. The HPV vaccine is very important and should be given to children between the ages of 9 and 12 years old. Adolescents and young adults between the ages of 13 and 26 should receive this vaccine as soon as possible because it will not be as effective when given to young adults. Anyone who has a cervix should engage in routine Pap tests or Pap smears and HPV testing. Pap smears are done just to monitor the cells of the cervix. In HPV tests, they check the cells to see if the HPV virus DNA is in the cervical cells. Practice safe sex to reduce the risk of developing cervical cancer by preventing STIs, and do not smoke tobacco. How often should you get screened? Pap smear should begin at the age of 21 and can be done about every 3 years until the age of 29 if your results are normal. If you are between the ages of 30 and 65, you should speak with your primary care provider to talk about which testing option is best for you. The HPV test can be done every 5 years, as well as the co-testing. Co-testing is when the HPV test is done along with the Pap smear. And if you are 65 years old and older, and have had normal test results for several years or have had your cervix removed for a non-cancerous condition, then you do not have to engage in cervical cancer screenings anymore. What are the signs and symptoms? During the early stages of cervical cancer, there are usually no signs or symptoms. But as the cancer begins to grow into nearby tissue, that's when the signs and symptoms begin to occur. The most common symptoms are vaginal bleeding after intercourse, between periods, or after menopause, unusual vaginal discharge, and this could contain blood or even have a foul odor, and pain during intercourse. But other signs and symptoms can include swelling of legs, complications when urinating or having a bowel movement, and even blood in your urine. What happens after being diagnosed with cervical cancer? Tests will be ran to determine if the cancer has spread to any other parts of the body, and if so, how far. This is also called the staging process. Information taken from the staging process determines the stage of cancer. So, tests that can be done are imaging tests such as x-rays, CAT scans, MRIs, and this basically helps determine if the cancer has spread anywhere beyond the cervix, or visual examinations of the bladder and rectum can also be done. Cervical cancer has 4 stages. In stage 1, this basically means that the cancer has formed, but it is only found in the cervix, and it can be divided into 2 stages, stage 1A and stage 1B. And this is based on the deepest point of the tumor invasion and the size of the tumor. So the tumor can be as small as 3 milliliters or less, and as big as 4 centimeters. Stage 2 of cervical cancer basically means that the cancer has spread to the upper 2/3 of the vagina or to the tissue surrounding the uterus, and this is also divided into 2 stages. The tumor can be as small as 4 centimeters, or it can grow larger than 4 centimeters, and the cancer also has the opportunity to spread to the surrounding tissue around the uterus. Stage 3 cervical cancer. So during stage 3, this means that the cancer has spread to the lower third of the pelvic wall and or vagina, and it is now causing kidney problems, and it may even involve lymph nodes. And this is divided into 3 stages. So stage 3A, the cancer has spread to the lower third of the vagina, but it has not spread to the pelvic wall. Stage 3B, the cancer has spread to the pelvic wall and or that the tumor has become large enough to block one or both of the uterus and has caused one or both of the kidneys to become bigger and even stop working. And stage 3C is also divided into 2 parts. And this is basically based on the spread of the cancer to the lymph nodes. So stage 3C1, the cancer has spread to the lymph nodes in the pelvis, and stage 3C2, the cancer has spread to the lymph nodes in the abdomen. Stage 4 cervical cancer. So during stage 4, the cancer has begun to spread beyond the pelvis and has spread to the lining of the bladder or rectum, or it has even spread to the other parts of the body. Stage 4 is also divided into 2 parts. Stage 4A, the cancer has spread to nearby organs like the bladder or rectum, and stage 4B, the cancer has spread to the liver, lungs, or even bones. How can you treat cervical cancer? Cervical cancer has 5 common treatments, which are surgery, radiation therapy, chemotherapy, target therapy, and immunotherapy. Surgery. This is the removal of cancer during an operation. You have conization. This leaves the cervix intact, and this is a procedure done to remove a cone-shaped piece of the tissue from the cervix and the cervical canal. A total hysterectomy, this can be done several ways, and this is removing the uterus and the cervix either through the vagina, a large incision through the abdomen, or a small incision in the abdomen using a laryngoscope. You also have a radical trachelectomy. This removes the cervix, nearby tissue, and lymph nodes from the upper part of the vagina, but the uterus and the ovaries are not removed. And you have pelvic exenteration. This removes the lower colon, rectum, bladder, cervix, vagina, ovaries, and nearby lymph nodes. But plastic surgery can be performed to create an artificial vagina. You have radiation therapy. This uses high energy X-rays or other types of radiation to kill the cancer or stop them from growing. This can be done either externally or internally. You have chemotherapy. This is treatment that uses drugs to stop the growth of cancer cells by either killing them or stopping them from dividing. And this can either be done orally or injected into a vein. There is target therapy. This uses drugs to attack specific weaknesses found in the cancer cells, and it does not harm normal cells. And you have immunotherapy. This treatment uses your own immune system to fight the cancer, and substances can be made by the body or in a laboratory and used to direct, boost, or restore the body defenses against the cancer. Before exiting the video, please take the post survey.